they do, and sometimes they don't, but we try to hit it every single time that we can. Mostly because this is real life. You know, you can have all the quality measures you want every single day, looking at them, looking at the data, but are you really touching every single patient in the way that that patient needs you to reach out to them? When you're developing all the protocols for them, are you really addressing their concerns and their needs for cancer? You know, some patients come in there and they don't have anybody. They have themselves, but some patients come in and they have, you know, their own healthcare navigators in their families. And you guys know in your families who those healthcare navigators, if you were to get sick, are, right? There's some bossy people in our families, but that's a good thing, right? But we are so fortunate that we have people at the clinic that are there for those that don't have a lot of people to help them manage their healthcare. And we are in an environment to do no harm. There are some people in government I would like to harm. But that doesn't leave the room. But when you've been doing this for 28 years, and this is my 28th year, having worked in all those facilities and been blessed to do so, that they just don't get it. And at some point, who's getting it are the physicians that are treating the patients and the physicians that are directing the care for those patients every single day. And you gotta have a lot of respect for that, because they did that crazy residency where they didn't sleep for days on end, right? And they came up with their own, not only that they have to manage the quality measures for their hospitals and where they did their training, but they also had to develop their own quality measures within themselves and their hearts and how they were going to treat those patients on a day-to-day basis. And I'm forever grateful for these physicians. And also they pay me really well to tell you guys that. They're wonderful doctors, and I'm just lucky to be with all of them. I have a quick little story. Jose Avilla is one of our physicians there at the Cancer Center. And he was my dad's altar boy. Just off the record. But he went to school in Oklahoma, finished his residency at the University of Chicago. This guy was like badass, right? Was working in one of the ERs in Chicago. You can imagine what this guy went through. And then did his oncology residency in Oklahoma. I think that's awesome. I'm gonna stick to that. So then I interviewed him at the New Mexico Cancer Center, and I was kind of making a connection as to who he was, but I didn't really recall. And I'm sitting there and I'm interviewing this really young doctor. He's probably like 15 years younger than me, and he's really intelligent and really enthusiastic. And he's really quiet in this interview, like alarmingly quiet. And I'm like, who is this guy? And I'm like, Dr. Vidya, do you have any questions? I think your interview went really well. Not. Just real quiet. And he said, you sound just like your father. And I was like, what? He's like, yeah, I was your dad's altar boy. Your dad was the deacon out of the Catholic Church out there in Grants. He's like, and you sound just like your dad, and it's freaking me out a little bit. And I was like, but this is the connections that we have to our physicians. So this is why I'm connected to making sure that we take care of them, and that the staff is competent to be able to take care of the physicians and the staff every single day. And they dot their I's, and they cross their T's, and they write those progress notes out, and this is what we do. So the drinking is me generally, or I'm under my desk sucking my thumb because there's so much going on. We provide quality health care. Right? So we're an independent physician practice. We practice medical oncology, radiation oncology, radiology, and fusion services. We have brilliant people that work for us. We have physicists, 3 of them, that help us manage across the state. We treat radiation oncology at 3 clinics across the state. Silver City, where we partner again with Gila Regional. They have a LINAC there. We do the radiation treatment there. In Gallup, we do radiation treatment there. And these rooms are impressive, right? They have these big old lasers, these amazing machines, and these incredibly talented technical staff that come in and make sure that every single time they go near a patient, it is the most targeted direct therapy you can imagine and can receive. Again, managing the risk. So we have infusion services where we have the most gifted nurses that are taking care of our patients every day. Did you guys know that our nurses mix chemo? Our nurses are the ones back there. They train in an independent practice and in a lot of other oncology independent practices across the nation. The nurses are trained to mix the chemo. And they mix it, and we have partners, we have pharmacists that are in there helping them, but you can't even imagine the competence of these nurses. So not only do they know the science of the drug, they know the science of the drug and what's going into their patient. And if you think they don't care, they care. They know exactly what's going down. They know exactly what's about to happen. And so I love me some nurses. They're great, wonderful ladies and men. Know your product. Are you in the red or in the black? I say this all the time, and this is kind of a quick movement forward, but we manage a lot of chemotherapy. Chemotherapy is expensive, and we manage this through these big cabinets that track it, how much chemo is coming in, how much chemo is going out, who's it going to. I mean, all that's tracked so that our financial people upstairs know exactly what's going on, and they can help the doctors manage the costs every single day. Culturally sensitive and clinically sound physicians. So we have a clinic out in Gallup. Part of what I do at the New Mexico Cancer Center is I sit on some committees across the state. Two of them are funded by the CDC, the Centers for Disease, and the money comes from the CDC, goes in through the Department of Health, and those people, you talk about dotting your I's and crossing your T's, the Department of Health people, they are on it. And so I work with the Chronic Disease Prevention Council and the New Mexico Cancer Council. And we set the message for what's happening in cancer care from many different facilities, including Presbyterian UNM and Lovelace across the state. We are targeting the message for what we're going to educate patients on every single year, what white papers are going to be written, and we partner as teams. And people don't know this goes on behind the scenes. There are not enough people doing this kind of work in a state the size of New Mexico. We need more. And we're looking for that talent all the time. And we're very lucky to be able to work. Some of my best friends work at the University of New Mexico. I worked at Presbyterian. You can imagine how many people that I work. I'm so blessed to work with every day from there. So that's kind of how we roll. Competent and engaged staff, have to have it. Training is constant, and we have to have a statewide presence. This doesn't leave the room. Because I'll know if it does. Because we're an independent practice, and this is the commitment that the physicians have to making sure that patients are getting cancer treatment across the state, they lose money every time they are not seeing a patient at length. Can anybody guess why? Every time one of our physicians is not seeing a patient in our primary clinic, we're losing money in another clinic, in that clinic. And the reason is volume. So even though to the general population, they don't want to hear about the economics of cancer, preventing cancer in the state, that's a reality every single day. It's just the reality of it. And so what we need to do is we are constantly working to try to manage, making sure that our physicians are in those clinics and they're seeing the amount of patients that they could possibly see, but they are out there all the time. And they love being out there. Dr. McNamee's favorite clinic is the Gallup Clinic because she loves the Navajo people. She will always be out there. When she built a grand castle as far as an administrator is concerned. When I walked into that clinic the first time, I was like, what is this? I mean, it is beautiful. And she wanted it that way so that those people knew that she cared about that community and those doctors cared about being there, and that's what they do. And it's the same with all the other clinics across the state. When we went to get down to go practice in Las Cruces, she wanted to make sure that they felt that same level of competence when they walked into the clinic down there, and it's beautiful. And I think that means a lot. When you walk into the clinic, you want to see competence. And part of that competence is in what does the building look like. People laugh all the time because for the longest time I managed the facility statewide. They took it away from me because I'm half crazed. And I used to smell the carpet. And so they were like, why are you smelling the carpet? And I said, because when my patients are in the building and they're immunosuppressed and their other senses are heightened, when some of their other senses are taken away because of their chemo, they can smell what's in the carpet. And if I can smell what's in the carpet, they can. If it's making them sick, it's your ass. And they'd be like, what's wrong with this guy? Take facilities away from him. And so I had it for 7 years. I know just enough to be dangerous, but I loved that job. And now there's somebody else a little bit more calm, but that's doing that job, and he's fantastic. So, are you following me here?
Yeah.
Sort of. Thank you. So here we go. We're going to talk a little bit about who our strategic partners are. Hospitals. 58% of hospitals are scooping up physician practices to build a competitive advantage. Has everybody